Hi, I'm Dr. Mark Feinberg of UB Orthopedics and Sports Medicine. I've put this video together to help you better understand ACL injuries. The anterior cruciate ligament, or ACL, is the primary stabilizer of the knee. It is a strong, fibrous band of tissue at the center of the knee joint which holds the thigh bone and shin bone together during active knee motion. The majority of ACL injuries are associated with sports participation, with an average age of about 25 years. It is typically torn when the knee twists abnormally. There is frequently a pop in the knee with swelling and giving out. The instability places the knee at further risk of cartilage injuries and arthritis. An ACL tear, as seen here, will not heal on its own. The torn ends of the ACL cannot simply be sewed together. The ACL must be reconstructed using a graft. The ACL is usually replaced with a graft taken through an open incision around the knee. The most common options are the patellar tendon and hamstring grafts, with equally good results. Let's go through the steps involved with the patellar tendon graft ACL reconstruction. A patellar tendon graft is taken through an incision on the front of the knee. Every attempt is made to make the most cosmetic incision possible for harvesting the graft. The central portion of the patellar tendon is removed using a scalpel and motorized tool. The ends of the tendon are attached to plugs of bone from the patella and tibia. These plugs of bone will help anchor what will become the new ACL. Small incisions or portals are made in front of the knee joint. The camera or scope and surgical instruments will go into these incisions. Saline solution flows through a tube and into the knee to expand the joint and to improve visualization. The image is sent to a video monitor where the surgeon can see inside the joint. Diagnostic arthroscopy is performed to evaluate the structures surrounding the torn ACL, including the meniscal cartilage and the articular cartilage. Any lesions of either of these structures are repaired. A surgical instrument is inserted into the joint and the torn ACL is removed. The center of the ACL insertion points are precisely identified. Aiming guides are inserted into the portals, which allow the surgeon to pass a guide wire through the tibia and femur to help accurately drill the tunnels. A surgical drill is inserted over the guide wire, and new tunnels in the femur and tibia are created for the new ACL graft. The end of the graft is tied to a loop on the guide wire, and the graft is pulled into place. Screws are used to secure the plugs of bone into the tunnels. Over time, the plugs of bone will incorporate into the surrounding bone. With the new ACL in position and secured, the surgical instruments are removed and the procedure is completed. The grafts will incorporate into the surrounding bone. ACL surgery is usually performed on an outpatient basis under general anesthesia. The procedure takes approximately 1 hour. Additional time may be required to address any cartilage injuries. A knee immobilizer and crutches are typically used for 2 to 3 weeks. Physical therapy is started immediately with a focus on regaining motion and gentle strengthening. An effective rehabilitation program should allow for normal walking by 1 month and light jogging by 3 months. Return to jumping and pivoting activities typically occurs at 6 months after surgery. Thank you for allowing me to share this important information regarding ACL injuries.